Thank you. You mentioned that you came to the conclusion that the intention of parents to immunize their children is very high in British Columbia. Can you put some numbers to that, or names of studies or surveys that you've looked at? Any data that you can share on that?
Sure. So we've done a number of studies through the Vaccine Evaluation Center. They've done their spring study, as well as some of the work that's been done by our behavioral folk, BC CDC and other places. And in general, we tend to be higher than the polls that we've seen presented nationally. And from the example that we have from the Vaccine Evaluation Center, it was 68% of parents were wanting to have their children vaccinated right away, and another 20% within said they're absolutely going to vaccinate their children in the next little while. So those are the types of numbers that we're seeing here in BC, so slightly higher. And I think what we'll see is similar to what we saw when the vaccines first came out, that once they're available for people, once we get a level of comfort in how well they're working and people see that others around them are being vaccinated and how well it's working, that we'll see an increase in people having that confidence to book their own children in as well.
Lisa, do you have a follow-up?
Yes. Do you believe, as some critics have charged, that your messaging that COVID is...
I'll interrupt you for 2 seconds.
I was just going to say the one other thing that we're watching really carefully is the experience in other countries. And we know that close to 3 million children now have been immunized in the United States. And I've been on calls with my colleagues from Region 10, so Washington, Alaska, and Oregon. And they've really had a really positive experience with children. And what we have not seen are any other safety signals that have come up with the 3 million children in the U.S. So those are things that we'll be making sure that parents are aware of as well. So sorry, Lisa, I didn't mean to interrupt you.
Thank you, Lisa. Please proceed with your follow-up.
Yes. I just wondered if you believe, as some critics have charged, that your messaging around COVID-19 and children is that, it's rarely transmitted in schools, and that children with who do contact COVID, their symptoms are very mild. Do you believe that messaging has created a sort of hesitancy or a lack of urgency maybe on the part of some parents? And how will your program sort of address that?
Yeah, I don't believe that. What we're trying to do is balance the fact that schools are a safe and important place for children. And, I mentioned our Speak survey. The first one told us that closing of schools was really hard on families across the board. No matter what, where you lived or what income you had, it was difficult for families. But we've also seen the disruption that children have faced on activities, on social activities, and school is not yet normal. I don't need to say that to anybody who has children in the system. So this is important. It means that the things that we're doing are working to help get as normal as we can for children in this pandemic time. But the reality is we're going to be living with this virus for some time, in terms of years. And right now, we are still in a risky period where we're seeing children get sick with this, and younger children who've not yet been able to be protected are getting sick. And it is, as I say all the time, thankfully, mostly a mild illness, but it does cause severe illness in some children. And we know that sometimes children bring it home, and it can cause more severe illness in other members of the family. So it is important across the board to get us through this. Nobody wants children to get sick, even if the probability is that mostly they're going to have a mild illness. And so this vaccine is important. It's important to help reduce that anxiety, but also to help children get back to more normalcy in their lives.
Just say finally, the evidence is that people in British Columbia want to be vaccinated at very high rates. And with respect to schools, we have had vaccination against COVID-19 since May. We have one of the highest, certainly in any of the jurisdictions anywhere near us, the highest level of vaccination of children children and youth 12 to 17 already, which is well north of 85% in those categories. So the evidence is that children, youth, parents, and British Columbians want to be vaccinated at very high rates, and higher rates in other jurisdictions. And that's because I think of the outstanding work of public health, of educators, of communities, but and of all British Columbians. We have, to a great extent, all been in this together, and overwhelmingly people in BC, 90.9% of people over 12, the vast majority, more than 17 out of every 20 children between 12 and 17, and a high proportion of young people between 18 and 30, I think as high or higher than anywhere else in the world in those categories, demonstrates the commitment of British Columbians and the work, I think, that's done by our public health teams around BC. So the evidence is clear in all of the other groups that we've been offering immunization to, and I think it'll be clear in this group. But we've got lots of work to do, and there are more questions to answer with children 5 to 11, and you have public health teams and communities going to work with everybody to make sure their questions are answered.